as we know, identification is identifying one patient from another. So different relevant informations are mentioned under this identification part. So before writing the identification of the patient, always we should write the date and time of the history taking. This is relevant because the progress of the patient may vary from day to day. Patient may have one symptom today and may disappear tomorrow. Patient may not have one symptom today and may appear tomorrow. So if you mention the exact date of that patient evaluation, so we can differentiate, we can know the progress of the patient, whether the patient is improving, whether the patient is deteriorating, whether the patient is developing additional symptoms, whether the patient is symptoms are disappearing from the previous one. So in order to know the baseline, or even in order to compare, so always we should mention the exact date and time of history taking. Time is because patient again may have the patient condition may vary from morning to evening. So the exact time, the time of the patient evaluation should be mentioned. So always when we write history, at the top of our history paper, we should mention the date and time of clerking or evaluating the patient for this reason. So after that, we will proceed with the identification of the patient. The identification of the patient has its own components. The status with mentioning the name of the patient. Then we will proceed with age, sex, marital status, his occupational status, his educational status, and his date of admission, hospital, ward, bed number he was admitted, and the mode of his arrival, the source of the history, and the source of, again, the referral, if the patient is referred from other health cares or other health facilities. So always we have to mention the referral. And finally, whether the history is the source of history, the patient himself or the parents or others, it should be mentioned, and the language the patient uses, whether it's with the help of a language translator or not, should be mentioned. So these are the components that we should include under the identification of the identification part of the patient history. So let's take one sample history, one sample identification of a patient, and we will elaborate them. The main reason why do we want to know those things under the identification part of the history. This is Muhammad, a 20-year-old male unmarried farmer, was completed 5th grade from Jimma Zone, Sarbo Warada, admitted to Mikfa Medical Center, Internal Medicine, Cardiac Unit, room number 3, bed number 2, 6 days back after he arrived by public transport, being supported by his family after he was referred from a local health center. The source of history is the patient himself with the help of a language translator. So as you can see in this history, the identification part has different components. So let's elaborate the main reason why we need those things on our history. The first one is the name. It's straightforward. I don't have to elaborate it. It helps to differentiate one patient from another patient. So the name of the patient helps us to simply differentiate, because in large health facilities we may have a number of patients. So it helps us to differentiate one patient from another. The next thing is the age of the patient. As you can see here, the age of our patient is 20 years old. When we study every disease, there is one component which says epidemiology of the disease. Under the epidemiology, always there is the age distribution of the disease are usually mentioned under whenever we study whatever disease we study, the age distribution of the disease will be mentioned. This is because the distribution of the disease is different under pediatrics age group. It will vary during adolescence and during adulthood to elderly. We will have different disease entities, and the different diseases are common at different age groups. For that reason, knowing the age of the patient helps us to narrow our differential diagnosis. Let me give you a few examples. If we take the disease called bronchiolitis, this disease is common in pediatrics age group, especially on children less than the age of 2 years. So, children less than 2 years present with cough, wheezing, which can be audible or which can be physical finding, and difficulty of breastfeeding and the like. So, whenever a child presents with the symptoms below the age of 2 years, we will consider bronchiolitis as one of our differential diagnoses. So, this disease entity will not appear after the age of 2 years. So, if you get a child with the same symptoms after the age of 2 years, you will not consider this disease entity. Rather, you will consider another common disease. For example, you may consider childhood asthma after the age of 3 years, especially the peak age for asthma is 3 years, and then after a child presented with wheezing disorder, your impression might be hyperactive airway disease or childhood asthma. So, knowing the age of the patient helps us to narrow our differential diagnosis. You don't have to worry about those diseases. You may learn them in your future, and we may also discuss the diseases on our future bedside sessions. For now, what I'm going to tell you is just to know the relevance of taking that components of the history, not knowing about the disease entity. So, this is one of its significance. For example, another example, heart failure is a common disease condition in almost in all age groups, but the underlying cause of those heart failures vary depending on the age of the patient, based on the age of the patient. For example, during childhood, if a child presents with heart failure, most of the time the underlying cause of that heart failure is more of its congenital heart diseases, which can be cyanotic or acyanotic, whatever. The underlying cause of that heart failure is more of it can be from congenital causes. If adolescents or adults present with heart failure, the underlying cause of that heart failure might be from rheumatic heart disease, and different epidemiological factors, different cardiomyopathies can also contribute for heart failure in these age groups. And if elderly presents with heart failure, the underlying cause can be from different degenerative valvular heart diseases, or it can also be as a consequence of hypertensive heart disorders. Heart disease can be a contributor or the main reason for the patient to develop that heart failure. So this is the main reason that we are to ask a patient. For example, our patient is 20 years old. So after knowing the chief complaint of our patient, we will discuss the significance of or the relevance of his age. Knowing he is 20 years old, what's its relevance and how it narrows our differential diagnosis. So we will discuss on our next series of our videos. For now, I hope you understand the main reason why we ask the age of the patient. So the next thing is sex is important, whether the patient is male or female, because under epidemiology of every disease, some of the diseases are more common on males, some of the diseases are more common on females. For example, autoimmune disease or immunologic disorders are usually associated with females, and There are also disease entities which are exclusively occurs on male, for example, genetic disorders associated with X-linked disorders like hemophilia, usually almost always occurs on males. So this is a bleeding disorder, and you will consider this differential diagnosis in male. And by nature, male and female have different reproductive organs. So from those reproductive organs, different diseases may arise. For example, a 40 years old male presented with abdominal swelling, and the same age 40 years old woman presented with abdominal swelling. So on a 40 years old woman, you may consider a mass which arises from her ovary, because ovary, uterus, these components, these organs are found in woman abdomen, and you may not find them on male. So in this scenario, you may consider ovarian tumor, you may consider uterine fibroids and other tumors arising from this organ, from the woman, not from the male or from the man. So knowing the sex of the patient, you can easily narrow the differential diagnosis. So you will not consider myoma, or you will not consider pregnancy on a 40 years old man, but you may consider them on a 40 years old woman. So this is the main reason that helps us to know the sex of the patient. Additionally, for example, stroke is more common on male. There are different chronic illnesses which are considered to be more common on male because of different both natural factors and other personal factors. So if you have mentioned the purpose of knowing the sex of the patient, now let's proceed. The other point is knowing the marital status of the patient. Of course, the patient he might be married, he might be divorced, he might be widowed, or and the like. So knowing these factors, its relevance, all of these status may have their associated psychiatric problems, even they may have different contributions for the patient disease condition. For example, a person who has a polygamous marriage might be at risk of different sexually transmitted infections, including RVI. So knowing those status helps us to identify this. The other thing is, for example, if I am working in obstetrics department, women may come for antenatal care. This is a care that's provided for pregnant women during the course of the pregnancy. So whenever she came to antenatal care, I may ask her her marital status. If she is married, that's good. And because husbands had their role, their contribution, their role in the course of the pregnancy, for that reason, knowing those marital status of the patient is important. The other thing is occupation. Occupation is important because different occupation predispose people to different diseases. Let's mention a few of them. For example, a person, asthmatic patients. Usually asthmatic patients need some triggering factors in order to develop those symptoms of asthma. So whenever they have asthmatic attack, they may be their predisposition to those occupational factors or occupational triggering factors. For example, those working in factory, those working in farming, those working in mining, those conditions might be the triggering factors for that asthmatic attack. So whenever a patient comes with that symptoms, with that disease entities, we should assess the risk factors, because one of the treatment is avoiding or removing those triggering factors. So knowing occupational status of the patient helps us to understand those disease conditions. The other thing, for example, patients, especially people from our country, Ethiopia, Our mothers use combustion fuels in order to prepare food for home or for commercial purpose. So those who are engaged on these activities, they might be predisposed to obstructive lung disease. So the risk of developing this disease might be high. Those who have exposure to asbestosis asbestos exposure may develop asbestosis. Those with hypersensitive pneumonitis may develop different disease, those interstitial lung disease from exposure to certain triggering factors due to their occupations. And the other thing is the address of the patient. Patients may have, as I have mentioned in the epidemiology of the disease, one and the other and most important thing is in which area the disease is common, because disease distribution varies depending on the climatic condition of the regions, the geographic condition of the regions, and different fauna and the plant and the animal diversity of the region. So this contributes to might be the risk factors or predisposing conditions for the development of those diseases. For example, if a man presented with fever, for example, fever which is typical for malaria, and if the man came from tropical region, immediately I would consider malaria. As my differential diagnosis, not a diagnosis, but as a differential diagnosis. Malaria will be one of the differential diagnoses. So from which area the patient is coming, the address of the patient is relevant. For example, if the patient with a fever came from England or in general from higher latitude areas, I will not consider malaria, because malaria is not endemic in that area. So knowing the address of the patient helps us to narrow or to consider additional differential diagnosis. For example, in our country, Ethiopia, most of our land is malarious, but it's not all. Especially malaria is common in areas whose altitude is less than 2,000 meters above sea level. So in humid and hot areas, this infection, malaria, is more common. For example, a person who came from Gambia with fever, immediately I should consider malaria. On the other side, if he came from the capital of the country, for example, Addis Ababa, which is above almost 2,400 meters above sea level, so in this area, malaria is not endemic. So rather than considering malaria, I may consider other differential diagnosis. So this is the main significance of knowing the address of the patient. The other thing is the academic status of the patient. For example, our patient has completed 5th grade. So knowing the academic status helps us to choose the appropriate work to explain to the patient about the disease, about the treatment, and the like. So knowing the address of the patient is very important. The other thing is knowing the ethnicity and the religion of the patient. Usually ethnicity, specific ethnic group doesn't have relevance, because peoples nowadays are intermixed. But some disease conditions are more common in black race. For example, the risk of hypertension is higher. Even the risk of developing the complication of hypertension is higher on black populations. Ischemic disease relatively is common on black populations. Knowing the risk might be helpful, but it's not that much significant on reaching the diagnosis of the patient. And knowing the patient whether he is Mongolian or Caucasian. Some disease entities are more common on Mongols, some are more common on Caucasians, and the like. So sometimes it might be relevant, but it's not that much significant on history taking. So the other thing is the religion of the patient. For example, religion called Jehovah's Witness. So in this religion, blood donation and receiving another person's blood is not acceptable. So always, for example, a patient may present with acute surgical conditions and you may take him to the OR. So if he asks, if you know the patient is a follower of this religion, so So first we should take the consent of the patient to take the blood, and or from the patient or from the family, whether he is willing to take the blood or whether he is willing to take the risk of the complications or the risk of not taking the blood. So in order to take this consent, you should know the religion of the patients. The other thing is, on our identification part, we should mention the hospital number, the bed number, the ward, and the bed number. This helps us to directly, one thing, it will directly tells us the address of the patient in the hospital. And the other thing is, again, it helps us to differentiate one patient from another. Because in cardiac unit, almost all of the patients may have the same diagnosis and the same treatment, but specific variation within the management and diagnosis of the patient can be identified based on the bed number of the patient or the room number of the patient. So knowing the hospital, the ward and bed number mentioning in the identification part is important. The other thing is, we should mention the date of admission. For example, our patient is admitted 6 days back. So if he is admitted 6 days back, within the past 6 days, for sure he took different medications. They get different treatments. For that reason, he may have different improvement on his clinical condition. Some of the symptoms may disappear, though they may not present. So if we know he is admitted 6 days back, we can know the progress of the patient, his improvement. The other thing is, when we take the comprehensive assessment of this patient, we will ask him his clinical condition before 6 days or before admission, so that we can reach on the appropriate assessment or diagnosis. So this is the main significance of admission, or the date of admission. Then we will mention the mode of arrival, how the patient arrived to the hospital. This will tell us the severity of the disease, the disease condition, how critical is the patient. If he arrived being supported by his family, being supported by his family members, or if he present by ambulance or in the like, so he is most likely is critical, or the disease condition is very severe. If he arrived by himself without any attendant, most likely he is not a critical patient. So how critical is the disease condition can be assessed by knowing the mode of arrival of the patient. The other thing is the source of referral. Again, referral by itself tells us the severity of the disease. Most of the conditions they are referred from the lower health care facilities. This is because it is difficult for them, by the available resource, by the available knowledge, it's difficult for them to diagnose these conditions, and sometimes it's difficult for them to treat the disease after knowing the diagnosis. For that reason, knowing the referral helps us, even including in the referral paper, they will also mention the reason for the referral. So we can be focused on that area, and we can immediately, after evaluating the patient, we can proceed with the management of the patient. So source of referral, mentioning the source of referral along with its reason helps us to understand the severity of the disease conditions and how critical is the patient. And lastly, we need to mention the source of history. As I mentioned, the source of history can be the patient, or it can be from the attendant. Usually the attendants are the family members. If the patient on pediatric age group, of course, the source of history is the parents, and sometimes on adults, if they are unconscious, or if they are teasing, or if they have any aphasia, or if they have difficulty explaining their symptoms. In these conditions, the attendants might be the source of history. So in this condition, the quality of the history is different. If we get it from the patient himself, usually the quality is better, because he can exactly explain what he's feeling. So that will help us to reach on the diagnosis. So it will tell us the quality of the history. For that reason, this one is the most important part of the history. Lastly, we have to mention whether we use a language translator or if we were directly able to communicate with them. This is because if we use a language translator, of course the quality of the information or the quality of the data might be relatively low compared to directly communicating with the patient. For that reason, that will tell us the reliability and the quality of the information. So these are the components that